You were working 2 jobs for a while.
Yeah.
What was that like?
When I started, I thought, I'm going to work all these hours. I'm going to become a super nurse. And instead, what happens when you're working night shift, 70 hours a week, you start to not be able to retain information. Your life basically becomes work then sleep because you're doing 12-hour shifts. Sometimes they're 14 to 16 hours. I enjoyed it for a time and then started having kind of my own health issues. And then I eventually stepped down from the second job. So I'm not coming in exhausted and already mentally fatigued before the shift even starts.
Yeah.
Saying no and learning how to take care of yourself. That's where your focus is with your social media platform.
That's something I got really passionate about after I did the 2 years as a CV ICU manager, because I realized pretty quickly that that role was not going to be the best place for me mentally, physically. I was struggling. But in that process, I realized I have a hard time separating work and life. I bring things home with me. I would think about stressful conversations I'd have to have the next day with one of my staff members, and it'd keep me awake at night. My mind was spinning and I was distracted and I wasn't present. And my husband was telling me, like, I don't know if this is going to be the best thing for you. Are you really happy? And you don't want to be a failure. But I got to the point where I recognized that I was going to do better, I think, getting back to the bedside and being more in that supportive role. I also wanted to start talking about burnout because looking back, there's things I could have done differently. So now with social media, I try and promote the nurse wellness aspect of things, telling people, like, if you want to become that resilient nurse, there's things that you can be doing proactively, or if you think you're getting burned out, these are the signs and symptoms to watch for. And if you're seeing those things in others, it's important to call each other out too. So that's what I focus on now. But then also practicing what I preach. I'm doing endoscopy, where it's procedural nursing, which is a different twist. It's all day shift. It's no holidays, weekends. It feels like a different world than ICU and less stressful. I love being with patients. I love being a nurse. And what's nice is there's hundreds of ways to be a nurse.
Yeah, no role is worth your mental health, your physical health. At the end of the day, if you're not able to take care of yourself, you can't take care of someone else. So if you're finding that you're reaching that point, there's so many avenues that you can go. Finding something that makes you happy.
The last 2 years I've been dealing with GI issues and was just diagnosed with Crohn's, and trying to process that from the patient end of things, it's weird.
Yeah. So I was diagnosed with diabetes, an autoimmune form of diabetes where basically my immune system is shutting my pancreas down.
Yeah.
This is the rest of my life. This is what I'm going to deal with just with Crohn's for you.
In a weird way, it's nice to be able to relate to my patients and be able to tell them, I've had 2 colonoscopies now. Like, you got this. It's going to be okay.
I'm a firm believer in that it's the little things that you do for people that will make all the difference. And so maybe I can find ways to connect with people on this and letting them know that they're not alone. And someone comes in with a new diagnosis and saying, like, dude, I do understand what you're feeling, what's going on right now, because I'm so new to this too. And building a deeper connection with my patients.